So what are the different types of facelift? Well, we have different types of facelift because they fit different people. They're different needs based on your individual aging. What is the best result? Well, for many of my patients is looking natural, but that can vary from person to person. Most people want to look 8 to 10 years younger, but they still want to look like themselves. But there are some patients who want to look 20 years younger or more change. And if we're going to do more change, then we need to adapt the facelift surgery and the procedures in order to get that change. And we also need to think about recovery, because generally we want fast recovery, less downtime, and that means tailoring the individual treatments towards you. We want to avoid complications and revision rates, and certain procedures may be associated with more scarring. And of course, there are always advances in medicine, and adding volume was of key importance 10 years ago, and now we know that volume is important, but just adding volume all over the face does not result in a good natural result. Today we're looking at non-surgical facelifts. There are many different terminologies that use. There's liquid facelift, thread facelift, face tight, and all these different terminologies, and there's another 100 of these. The truth is, what are these really? Often another word for adding volume and fillers. Most of the effect of non-surgical treatments are really adding this volume component. They are not really facelift procedures. They have volume effects, they have skin tightening effects, but they're not lifting areas that have dropped. Fillers, non-surgical facelift has the most benefit for gaunt faces that have lost volume. But key is balance. Too much volume does not look good. Too much volume can result in a puffy appearance. What is non-surgical facelift? What does it mean? Well, the core ingredient in the majority of these techniques is fillers. And this is a complex gel made of hyaluronic acid, and here I am injecting just to demonstrate you what this gel is. And so we can use this gel in various applications in certain areas of the face to really improve certain aspects of volume loss. Thread lifting is a little different, because in thread lifting we're applying tiny little stitches that have tiny little barbs on them, threads that are put into various of the face, but they do dissolve. Like 10 years ago there was technology where these threads didn't dissolve and they lasted long term, but they really created a lot of havoc because sometimes they tethered the skin and they gave unnatural results. So modern day threads, they last for about 6 months and they do wear off, but they're not truly non-surgical because they do result in some swelling, some bruising, and I would say they have quite a high level of dissatisfaction. Certainly every week I see patients who are disappointed that they've had relatively low results from these treatments. Now, non-surgical facelift in the right patient, where fillers are put in very specific areas, can look very nice. And this is a patient of mine where I put fillers along the ogee curve, and there's a beautification point on the cheek where if any volume is added, particularly for a woman, it can just add to this ogee curve that looks more feminine. It beautifies the face. And then certain people can lose volume in the temple, so sometimes adding tiny amount of filler in the temple area can fill and improve that area. The lips, well, that can also look quite nice in some individuals. And when things are quite modest, sometimes a tiny amount of filler in the nasolabial area or marionette lines can be helpful, but by no means can that be used significantly and completely remedy this area, because this area is also affected by gravity. Where it's particularly powerful is the ogee curve, like adding volume along the cheekbone, the temporal area, the nasolabial line, and lips. Where fillers are much more hazardous and perhaps best avoided, well, too much filler in the glabella area, that can actually block a blood vessel and give skin necrosis. In the lower eyelid area, well, it's a very delicate area, the lower eyelids, and it can result in puffiness. We've seen that in a number of different celebrities, and that can really not look good, and often that needs to be dissolved. And then you need to be a little careful about the marionette area, because too much filler in this area just does not look good, because this area is coming down with gravity. Sometimes it just needs to be lifted with true facelift surgery. And along the jawline, and filler can be used in this area to hide the jowls and changes in the jawline. However, it makes the jawline much squarer, and what we really know in terms of youth is everyone has a more V-shaped jawline. So if it's made squarer, it can sometimes make you look older. So adding in these areas, well, it can just beautify the face. And it's not so much about massive change, it's just like subtle modification. We definitely want to avoid this. That's pillow face of Madonna, where too much volume is being added and the face has started to look round and it's lost its kind of natural contours. Similarly, Nicole Kidman, who often looks great, well, too much volume in the cheeks just gives a rounder chipmunk appearance, which we really want to avoid. So we can see in this patient of mine, well, the jawline is very V-shaped, and this can be recreated more with surgery than non-surgical facelift treatments, because non-surgical facelift tends to make the jawline squarer and rounder, but we know that people's faces are more youthful when they're more V-shaped. So really, this requires deep plane or vertical facelifting in order to restore the anatomy to where it used to be in some individuals. You know, squarer jawline, which has more puffiness, well, that could be a sign of just too much volume being added. So how do we avoid this? How do we avoid this done appearance? Well, really, it's about preserving natural anatomy and looking at how each individual has aged. Now, if someone has lost more volume, then non-surgical facelift can be really beneficial. If it's more skin laxity, there's more changes in the neck, and there's more of a squarer face, well, really you want to lift these areas back to where they used to be, and that means deep plane facelifting. So why is a non-surgical facelift not a real facelift? Well, the truth is they're centered about adding volume. They're looking for a quick fix. And as we know in life, a quick fix doesn't usually apply. Now, it may work for a short period of time in people who've lost more volume, but a non-surgical facelift is by no means a real facelift, and so it can never do the same thing. Thank you for watching. I hope this information has been useful for you. Thank you.